Cancer of the endometrium is the cancer of the inner lining of the womb. So just like all cancers, it's basically divided into 4 stages. The primary treatment is surgical staging by a trained gynae cancer surgeon. The surgical staging procedure comprises of taking peritoneal washings, removal of the uterus, cervix, both tubes and ovaries, and also the removal of the lymph nodes from the pelvic and the para-aortic regions. So in early stages, one can do a sentinel node biopsy using a robotic or a laparoscopic approach. A sentinel node biopsy is a procedure where you inject a dye into the cervix, which is the mouth of the uterus, and this dye goes into the lymph nodes. So the first lymph node which takes up the dye is called the sentinel node. The sentinel node is then removed and sent to the pathology lab for complete analysis. If there is no tumor in the sentinel node, there is no need to remove all the lymph nodes. This really improves postoperative recovery, reduces complications, and leads to an early discharge. In advanced cases of endometrial cancer, actually what happens is that if you're able to remove the complete cancer, it is always advisable to undergo a surgical procedure to debulk the cancer, and this leads to improved survival. After the surgical procedure happens, it takes 7 to 10 days for the biopsy report to come. Once the biopsy report is available, we discuss this biopsy report within our gynae disease management group tumor board, which comprises of gynae oncologists, radiation and medical oncologists, pathologists and radiologists, all those who actually care for women having gynecological cancers. Based on this report and the discussion in the tumor board, the adjuvant treatment is decided. Adjuvant treatment could be chemotherapy or radiotherapy or a combination of both modalities of treatment. The purpose of adjuvant treatment actually is to remove any microscopic, not grossly visible disease and to prevent the cancer from recurrence. So if women are detected with endometrial cancers in an early stage, the disease outcome is very good. The 5-year survivals are about 95 to 97%. So modern surgical state-of-the-art techniques have led to improved outcomes post-operatively, also less complications and faster return to home. So I would just say that the key is not to shun away and shy away from treatment advice as given by your cancer specialist. So adopt all the advices as given by your treatment specialists.